everyone, my name is Samantha Mottola and I'm going to be talking about the academic achievement gap and early interventions. The academic achievement gap can be defined as the multitude of ways that impoverished children, often children of color, fail to keep up academically with their middle class and upper class peers when it comes to test scores or standardized measures of achievement. It is most often used to describe the troubling performance gaps between Black and Hispanic students at the lower end of the performance scale and their non-Hispanic white peers, and the similar academic disparity between students from low-income families and high-income families. The relationship between SES, race, and ethnicity is closely intertwined. Research has shown that race and ethnicity often determine a person's socioeconomic status. Furthermore, communities are often segregated by SES, race, and ethnicity. Low socioeconomic Black and Hispanic communities often share common characteristics. They have low economic development and poor health conditions. Racial and ethnic minorities have worse overall health than that of white Americans, and health disparities may stem from economic determinants, education, geography and neighborhood, environment, low quality of care, inadequate access to care, inability to navigate the system, provider ignorance or bias, as well as stress. And these communities often have low levels of academic achievement. In the United States, 39% of Black children and adolescents and 33% of Latino children and adolescents are living in poverty, which is more than double the 14% poverty rate for non-Latino white and Asian children and adolescents. Minority racial groups are more likely to experience multidimensional poverty than their white counterparts as well. American Indian and Alaskan Native, Hispanic, Pacific Islander, and Native Hawaiian families are more likely than Caucasian and Asian families to live in poverty, and Black unemployment rates are typically double that of white Americans. As of 2008, Black men working full-time earn only 72% of the average earnings compared to white men, and 85% of the average earnings compared to white women. Research indicates that children from low SES households and communities develop academic skills lower than children from higher SES groups. For instance, low SES in childhood is related to poor cognitive development, language, memory, socio-emotional processing, and consequently poor income and health in adulthood. The school systems in low SES communities are often under-resourced, negatively affecting students' academic progress and outcomes. Literacy gaps from different socioeconomic backgrounds exist even before formal schooling begins. Children from low SES families are less likely to have experiences that encourage the development of fundamental skills of reading acquisition, such as phonological awareness, vocabulary, or oral language. Children's initial reading competency is correlated with the home environment, number of books owned, and parent distress. However, poor households have less access to learning materials and experiences, including books, computers, stimulating toys, skill-building lessons, or tutors to create positive literacy environments. Students are also less likely to have access to post-secondary and college information resources. Additionally, compared to high SES counterparts, young adults from low SES backgrounds are at a higher risk of incurring student loan debt that exceeds the national average. In addition, low-income schools are less likely to have well-qualified teachers. A teacher's years of experience and quality of training are correlated with children's academic achievement, so children in low-income schools are less likely to have well-qualified teachers. The schools are also less likely to have appropriate resources for learning. Research continues to link lower SES to lower academic achievement and slower rates of academic progress as compared with higher SES communities. Children from low SES families enter high school with average literacy skills 5 years behind those of high-income students. Children from less advantaged homes score at least 10% lower than the national average on national achievement scores in mathematics and reading. Children in impoverished settings are much more likely to be absent from school throughout their educational experience, further increasing the learning gap between them and their wealthier peers. There have also been links to negative psychological outcomes that affect academic achievement, which I will talk about in a little bit. In 2014, the high school dropout rate among people 16 to 24 years old was at the highest in low-income families, at 11.6%, as compared to high-income families at 2.8%. Low-income students fail to graduate at 5 times the rate of middle-income families and 6 times that of higher-income youth. Inadequate education and increased dropout rates affect children's academic achievement, which then perpetuates low SES status of the community. Increasing evidence supports the link between lower socioeconomic status and learning disabilities or other negative psychological outcomes that affect academic achievement. Low SES and exposure to adversity in childhood are linked to decreased educational success. Toxic stress in early childhood leads to lasting impacts on learning, behavior, and health. Children from lower SES households are about twice as likely as those from high SES households to display learning-related behavior problems. Higher levels of emotional and behavioral difficulties, including social problems, delinquent behavior symptoms, and attention deficit or hyperactivity disorder among adolescents is common. Higher rates of depression, anxiety, attempted suicide, cigarette dependence, illicit drug use, and episodic heavy drinking among adolescents is common, and an increase in levels of aggression, hostility, perceived threat, and discrimination. Now we're going to talk a little bit about early intervention for low SES children and their families. So initiatives that have been found to be most successful in closing the achievement gap are early intervention programs. The Economic Opportunity Act of 1964 established a variety of ways that children might benefit from social programs, one of which was Project Head Start. The effectiveness of early intervention programs is supported by specific national and state policies tailored to address the high risk factors for low SES families, such as complications during birth, maternal mental health, and housing and neighborhood conditions. Economists have also shown that increased societal investment in early intervention programs improves cognitive ability among low SES children, which then increases overall societal welfare in the long run. Early intervention programs designed to assist economically disadvantaged children first came to be known as compensatory education or early intervention programs. Today, these programs are more likely to be known as enrichment education. These programs are thought to be a form of an invisible safety net to prevent future problems of children that are at risk. As mentioned previously, various programs have been developed over the years in an attempt to close the gap by providing early support for young children and their families. The most popular of these initiatives are Early Head Start and Head Start. Early Head Start is designed to serve low-income pregnant women and families with children up to age 3, while Head Start is aimed at children between 3 and 5 and their families. There is also an American Indian and Alaskan Native Head Start program, which serves 34 AIAN communities, and a migrant and seasonal Head Start program, which provides specific services for children whose families are engaged in agricultural labor. So both Early Head Start and Head Start are federally funded comprehensive programs that are designed to promote development and school readiness for low-income children. These programs are also two-generational, which means they focus not only on the children but also on their families. Both programs also use a whole child approach in which they provide physical and mental health services as well as social services to families and children. In learning more about these programs, I think perhaps why they are so successful is because their core program values very closely align with the base principles of community psychology in regards to their respect and appreciation for diversity, context, empowerment, and multi-level interventions. The programs identify the strengths and concerns within the specific community or family to develop the most effective plan of action for a specific child and family. The two-generational approach that these programs are grounded in also plays a large role in the success of the programs, as parent involvement in early childhood has been found to be a significant predictor of child development success. Providing parents and families with skills and knowledge early on in their child's development will help them learn how to engage in cognitively stimulating activities with their children, as well as how to manage their child's behavior without using harsh forms of punishment. It is important to note, though, that Early Head Start and Head Start staff members must continue to understand and consider familial and cultural factors when implementing specific techniques and strategies that they may be using. Both programs aim to be part of the community by developing non-hierarchical relationships between families and staff in order to build trust. The programs have home-based services in which staff come to them. They also have center-based services in which children and family go to the program at the center or school. Both of these methods do take into consideration families' unique situations and their access to resources such as means of transportation. Recent studies have found that children who receive both support at home and in the center have the best chance of achieving academic success. These are just some statistics on the Head Start programs and their child and family demographics. So in the 2018 to 2019 year, the program served over 1 million children ages birth to 5, as well as pregnant women. 37% of the families that used the Head Start programs identified themselves as Hispanic or Latino, and 30% were Black or African American. About 28% of the participants were from families that primarily spoke a language other than English at home, and approximately 22% of participants were from families that primarily spoke Spanish at home. These are a few more numbers about the teachers that work in these programs. So the Head Start program employed and contracted over 270 staff members. Parents of current or former Head Start children made up about 23% of Head Start staff. Approximately a little bit over 1 million adults volunteered in their local Head Start program, and of these, 749,000 were parents of Head Start children. About 127,000 staff members provided child development services to children, including teachers, assistant teachers, home visitors, and family child care providers. Among child development staff, 30% were proficient in a language other than English. 72% of all Head Start-based preschool teachers had a bachelor's degree or higher in early education or in a related field with experience. The Head Start Act specified that 50% of center-based preschool teachers nationwide should have had these credentials by 2013. So within New Jersey, the New Jersey Head Start Association runs the Head Start programs. The mission of the New Jersey Head Start Association is to provide leadership to strengthen and inspire stakeholders through advocacy, support, collaboration, and communication to benefit New Jersey's youngest children and families. Currently, there are over 200 Head Start centers within New Jersey. Children from birth to age 5 from families with low income, according to the poverty guidelines published by the federal government, are eligible for Head Start and Early Head Start program services. Children in foster care, homeless children, and children from families receiving public assistance are also eligible for Head Start and Early Head Start services, regardless of their income, and pregnant women may also be eligible for Early Head Start. More information on eligibility for families specifically can be found on the website below. And to apply for Early Head Start and Head Start, a person would want to contact the program or center that serves their community using the Head Start locator tool on the website or by calling the number below. The local program can provide any required forms and answer any questions. They will also let families know what documents they need in order to apply for the program. The Passaic Family Head Start Center is the Head Start program that is closest to me. There are 3 locations within Passaic, New Jersey. They serve 250 families and seem to be meeting the needs of the community and the community's diverse population. They serve 255 children, to be exact, that represent 250 families from the city of Passaic. And these families are primarily working families, families that presently receive TANF services or temporary assistance for needy families, or families that formerly received TANF services. They are low-income families raising children in Passaic, which is an urban community, and it's super densely populated with almost zero rental vacancy rate. The services that Passaic Family Head Start provides include parent involvement, workshops, conferences, trainings, preventative health services, nutritional meals for children, quality early childhood education programs, disability and special needs services, as well as family services. The program is accessible to and involved in the community. On their website, they say that Passaic Family Head Start is committed to establishing and maintaining excellent relationships, alliances, and support from the parents, families, and local community in which they serve. So overall, for Head Start programs, the Office of Head Start within the Office of Administration for Children and Families, as well as the New Jersey Head Start Association, both work to advocate for program success by ensuring that its services are accessible to the children and families that they serve. So moving forward in thinking about the Head Start programs, while Early Head Start and Head Start are great in theory, and even in many of the communities that they are implemented in, such as the Passaic Family Head Start Center, researchers have found it really difficult to prove its effectiveness. More comprehensive research definitely needs to be done on the program's efficacy within the diverse populations to determine the benefits of these services and who benefits from the services. For example, one study found that Head Start benefits high-risk children and their families more than children and families at low risk, and researchers must also try to identify barriers to early intervention programs that low-income families face. Plus, in addition to proving the program's long-term effectiveness in increasing equity in academic achievement, researchers and community health professionals and policymakers must also consider if programs such as this are cost-effective. So more research needs to be done on that as well. And because these programs are geared towards low-income families, there needs to be more research on if these services are actually accessible to the families they are trying to reach. So overall, it seems like the benefits of early intervention programs such as Early Head Start and Head Start on certain populations are really significant, but again, more research needs to be done to improve the overall effectiveness of these programs in order to really narrow that SES achievement gap. And since one of the main concerns of early intervention programs is to identify the family's needs and to help them navigate difficult systems, these programs and services must continue to be made more accessible to low-income and low-educated families. Parent involvement also is really important to these intervention programs, so parents need to be able to attend activities and involvement opportunities, but often can't due to their work schedules and school schedules of their children. It's crucial that these programs work to accommodate family schedules in order to provide necessary supports. These programs also must continue to be individualized for each community and each family based on the community and family's specific needs. And although there are predetermined guidelines to these programs, they must also continue to be flexible in order to respond to the specific needs, again, of children and their families. One thing is that these programs can be really helpful for families with children with special needs, and increased parental awareness and knowledge of child development will in turn lead to willingness to pursue early intervention if needed. So staff and faculty development on how to identify special needs or developmental issues that children might be having is going to be really important as well. Thank you so much for listening to my presentation. These are a few helpful links and resources. I hope you were able to learn a little bit about the achievement gap and the different early intervention programs like Head Start and how beneficial it can be.